It's about that time of the year. It's March Madness. And did you know that more and more men are getting vasectomies right before March Madness so they can sit back, relax, and enjoy the weekend? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk all about the benefits and risks of vasectomies, what to expect before and after the procedure, and bust some major myths. Also, I have a little surprise to get your family and friends involved in your vasectomy experience, so make sure you stick around to check it out. As always, if you enjoy this content, make sure you subscribe and share this channel with your friends.
The vasectomy.
A vasectomy is a procedure where the vas deferens, or the tube that connects the testicles to the ejaculatory duct, is cut so that you can effectively be sterilized. It is considered a permanent form of sterilization, and so if you want to proceed with the vasectomy, you need to be sure that you absolutely do not want to have any further children. In the United States, about 500,000 vasectomies are performed a year. They're about 99.5% effective, and they're safer, less invasive, and have a quicker recovery than the female counterpart, which is tubal ligations.
You make a small incision in the scrotal skin. Isolate the vas and then you hold it in position with a towel clamp. Then you snip the fibrous tissue.
So when you're getting a vasectomy, what's going to happen? Well, that day you're going to show up for your vasectomy. Sometimes you may get a medication from your doctor that helps calm the nerves a little bit. So if you are nervous about it, make sure you ask your doctor if they can offer you something that will help relax you before the procedure. And then you come into the procedure room and the area is shaved and washed. And while this seems like a very kind of invasive thing, we do it all the time, so there's no reason to feel nervous. And don't try to shave yourself, because actually that can cause a higher risk for infection if you use a regular shaver compared to clippers that we often use. Then the urologist will drape off the area, so you'll get some blue towels and blue sheets that are covering you that will help kind of keep the area clean and sterile. You want to make sure that you're not going to touch down there, try to scratch or help or anything at all. You're going to keep your hands underneath the drape and try your best to relax. Then the urologist will proceed to find the vas deferens, and this will be on both sides. So they'll start on one side and they'll find the vas deferens. So they'll feel around the scrotum to feel this tube, and actually it's pretty easy to identify in most cases because it feels like a piece of spaghetti. In people who have normal anatomy, it's pretty quick to find. And then we inject a numbing agent into the skin, where we're going to make a small incision and along the vas deferens so that the nerves to that area are also numbed. This is the only part that you should really feel any sort of prick and a burn from the numbing medication. And after that, you should feel nothing more than tugging or pulling in the area. So as I mentioned, there'll also be an incision. So after you get numb, they'll then either incise the area where the vas deferens is or use a small instrument to open up the area where the vas deferens is, called a no scalpel technique. Ultimately, both techniques are great, and you shouldn't worry too much. They'll then find the vas deferens. They'll cut a small piece of the vas deferens and essentially either burn, clip, or suture off the ends of the vas deferens. It doesn't really matter which way they do this. As long as the urologist is experienced in the technique, the outcomes are very, very similar. And then they put a small suture in the area where they made the incision, and that's the whole procedure. It takes about 15 to 20 minutes and you're off. After surgery, what is recovery going to be like? Well, when you recover, you'll need about 2 to 3 days where you're really kind of taking it easy.
It was kind of fine for the first, 3 days. I was like, this is not a big deal.
No heavy lifting, no strenuous activity, hence why a lot of men do this right before big sporting events so they can relax for a couple days. You'll need some sort of ice packs or frozen peas to help kind of reduce the swelling in the area, which is usually the most bothersome part of the recovery. And ladies, this is a great time of year to encourage your partner, if you are both done having children, to go ahead and get a vasectomy. All right, the other important thing that you need during recovery is a good pair of underwear. So time for your surprise. Fellas, I'm sure you've all been there when your wives have gotten baby showers and gifts for their baby registries. Well, now it's your turn. Saxx Underwear is launching a ball registry. Yeah, you heard that right, a ball registry, where you can register for things like underwear, pajamas, socks, and get your friends and family involved so that they can buy you something to help you during your recovery. But the biggest and most exciting part of what Saxx Underwear offers is their underwear with their patented ballpark technology. Guys, if you haven't tried their ballpark technology, you are going to want to check it out. It's got a breathable hammock that keeps your scrotum in place to avoid chafing, friction, and the most annoying balls getting stuck to the leg, or BSTL. This underwear is made for every guy, whether they're undergoing a vasectomy or not. But the bonus is it can really help prevent discomfort during your recovery and help give it that support that it needs. The Saks Ball Registry is so cool. Not only can you register for all these amazing things, but you can unlock additional surprises like beer fridges, ball grooming kits, and so much more. Check out the link in the description to start your ball registry today. Your balls will thank you later. So we've covered you need scrotal support, some sort of elevation of the scrotum, as well as ice packs during your recovery. You can expect that for 2 or 3 days you'll be down and out, but after about 7 days you'll be able to resume normal activities and go back to having normal sexual activity. So in addition to the recovery, there are some risks you need to be aware of. There's a risk of bleeding, swelling, and bruising. So afterwards you can get some scrotal swelling and some discomfort afterwards, which is why, again, wearing a supportive underwear or even taking a rolled up towel and putting it underneath the scrotum when you're sitting or lying down can really help prevent that swelling. If you're noticing that your scrotum is getting very, very enlarged and purplish in coloration, please call your urologist immediately. You may have what's called a hematoma, or blood underneath the skin. Another thing is you may notice some blood in the semen, and this is completely normal after a procedure like this. If you're having this outside of having a vasectomy, make sure you check out my video where I talked about blood in the semen previously. And lastly, there's a less than 1% chance of having chronic scrotal pain after a vasectomy. Again, this is really, really rare, but it does happen. All right, now that we've covered the procedure, let's talk about some myths that hold people back from going forward with the vasectomy.
But what about, like, creativity? See, I write music for a living. Will I still be able to do that?
Do you write with your testicles?
A lot of guys are concerned that having a vasectomy might impact their sex drive or the amount of ejaculate they have. There is no data to suggest that vasectomy is correlated with developing any sort of erectile dysfunction. And also, only 5 to 10% of the ejaculate volume comes from the sperm itself. So it really shouldn't make a huge change in your ejaculate volume one way or the other.
I just have a couple of pre-snip questions.
Shoot. Which, by the way, you'll still do post-snip, if that was one of your questions.
Myth number 2, sterilization happens right away after the vasectomy, and that is absolutely not true. It takes about 20 ejaculations for you to clear out any sperm from the system after having a vasectomy. So as a rule, we always recommend that men who undergo a vasectomy have a post-vasectomy semen analysis to ensure that they're completely sterile before having unprotected sex with their partner. So during that time, sorry guys, you got to use a condom, and if you hate condoms, make sure you check out my video about condoms and how to pick the right condom for you so that you can find one that's more comfortable. Number 3, now that you've had a vasectomy, you never need to use any other sorts of protection at all. Well, if you're in a committed monogamous relationship and you've both been tested for sexually transmitted infections, yes, that is true. But if you're planning to have other partners or you're not sure about your partner's sexually transmitted infection situation, then you'll still need to use a condom to protect against any sort of infections. Number 4, vasectomies don't work. Well, in fact, they really do. Only about 2 in 1,000 people who get a vasectomy actually have a pregnancy after the vasectomy is over. This again stresses why it's so important to get a semen analysis after you complete your vasectomy so that you can be sure that you are completely sterile before you go ahead and have unprotected intercourse. And lastly, getting a vasectomy reversal is no big deal, and so go ahead and get a vasectomy. And that's not exactly true. While vasectomies can be up to 95% successful, they are much more invasive and more complicated surgeries than the vasectomy itself. Also, depending on how long it's been since you had your vasectomy and other specific characteristics of how you healed from the vasectomy, it may be as low as 50% success rate. So if you're deciding to get a vasectomy, please consider it a permanent form of sterilization. And the last myth is that vasectomies cause a drop in testosterone. And in fact, there's no data to suggest that after vasectomies, your testosterone levels change at all. In fact, your testes will still produce sperm, but that sperm will be resorbed by the body rather than coming out with the ejaculate. I hope this answers a lot of your questions. And as always, remember to take care of yourself because you're worth it.